Hi guys, it's Dr. Jackman, and today we're talking about polycystic ovarian syndrome as requested. So to the requester, I did not forget you, but I was just extremely busy last week and I've decided to save it for today. So polycystic ovarian syndrome is a syndrome with hormonal imbalance. In women, about 5 to 10% of women in the reproductive age group get this imbalance. The exact cause is not really known, but experts believe that it's due to imbalance between male hormones, which are termed androgens. They have a lot of high androgens in polycystic ovarian syndrome, as well as disorder in your insulin regulation. So there's some combination between these hormones being imbalanced that causes the symptoms and the signs of polycystic ovarian syndrome. So what are the symptoms and signs of polycystic syndrome, you ask? Good. Well, infertility is one, and actually a lot of patients actually present to us for infertility, the inability to be able to get pregnant easily. Also, patients present because they have infrequent menstrual cycles or no menstrual cycles at all, and if they do have a menstrual cycle, it's what we call an anovulatory menstrual cycle, meaning that they don't ovulate. They don't erupt your follicle, releasing an egg that eventually could become fertilized to become an embryo. They don't have that, which is why they will eventually also present for infertility. A lot of patients also have problems with hair, and it's kind of contrast when you have the hair issue, because some people have excessive hair growth, and it's usually excessive hair growth in places where women do not normally have hair, where more you have men having hair, because it's a sign of the high levels of the male hormones, the androgens and the testosterone. So patients could present with hair on their chest, on their chin, having like a mustache, on the excessive hair on their stomachs, and all these are signs of hyperandrogenism, as I said, excessive male hormone. And then they can also present with male pattern hair loss. So one aspect you have too much hair, called hirsutism, and the other aspect you have hair loss. Patients could also present with obesity. About 70 to 80% of patients with polycystic ovarian syndrome are obese, but, big but, do not be fooled, there are many slim women who have polycystic ovarian syndrome, and obesity is not a diagnostic criteria for polycystic syndrome. So don't think that because you're small you can't have it, and don't think because you are bigger in size that you do have it. But many patients who have polycystic ovarian syndrome are indeed obese. So androgenism, you have like severe acne, you have oily skin, you can have discolored, darker skin behind your neck especially. This is called acanthosis nigricans, and it's usually a sign of insulin resistance, which a lot of patients with polycystic ovarian syndrome has. Though insulin resistance is also not a part of the diagnostic criteria. So as I mentioned diagnostic criteria so many times, I'm just going to tell you what is the diagnostic criteria of polycystic syndrome. So most people use what we call the Rotterdam criteria, and this is basically a criteria that has 3 factors that you only need 2 to diagnose someone with polycystic ovarian syndrome. So the criteria is that you can have signs of anovulation, or some people would say actually decreased menstrual cycles, so hypomenorrhea. So anything related to abnormalities in your period or abnormalities in your ovulation cycle is one part of the criteria. Signs of hyperandrogenism, which is the elevated male hormones, as I said, or on ultrasound you can have literally multiple cysts on the ovary called polycysts, so hence the name polycystic ovaries. Now, as I said before, that you only needed 2 of these 3 criteria, which means you can have polycystic ovarian syndromes without polycyst on your ovary if you do have hyperandrogenism and infrequent periods called oligomenorrhea. So it is possible. So having polycystic ovaries is not the same as having polycystic ovarian syndrome if your polycystic ovaries are the only thing that you have, and you don't have the hyperandrogenism, and you don't have the oligomenorrhea, which is the infrequent periods. Okay, so now that we diagnosed you, you have 2 out of the 3, or you have 3 out of the 3 criteria. There are other criterias, but this is the one, you know, we tend to use. Now that you have this diagnosis, now you want to know treatment, obviously. So treatment really depends on what you're trying to treat, what symptom you're focusing on, and what is really bothering you more than anything else. So for example, let's just say that the excessive hair growth is a problem for you. Then simply you can do a cosmetic treatment. For example, you can shave, you can wax, you can do electrolysis, you can do laser hair removal. So those are less medical, more cosmetic treatments. You can also use anti-androgens like spironolactone. That's one that people use as well. It keeps the androgen level down, so therefore the manifestation of the androgens will also, you know, decrease. So if your period irregularity is what we're focusing on, then you can use oral contraceptive pills, and this helps to regulate your cycle so you have normal bleeding, and in cases, you know, you can actually restart having like ovulatory cycles, but you would be on the birth control pills. So if you're using birth control pills, then obviously it's not a patient who's trying to get pregnant, because birth control pills will control birth, no pregnancy. Another option, if you are somebody who has like insulin resistance before, we can treat you with metformin. Metformin used to be like the to-go drug for like everything with PCOS, for like infertility, for everything, but it's really no longer that widely used because we have better medications that can be used. If infertility is your problem, and I should have said this one first, so just pretend I said it first, but actually if you are overweight or obese, then weight loss is a big help in PCOS. Just a weight loss of 5 to 10% can make a huge difference in global management of PCOS, especially when it comes to your menses as well as infertility. Weight loss, 5 to 10% of your total body weight. If you lose that, you're on the right track. And I'm not saying to stop there, but I'm just saying that it's a great help. So weight loss. Also for infertility, there are medications that can be used. So clomiphene citrate, it's what we call a SERM, a selective estrogen receptor modulator, and these can be used because they help you create more follicles in the ovary, so it stimulates more follicles. And the way they do this is pretending that you have no estrogen. So they block the feedback that goes to your brain to tell your brain there's estrogen there, and that tells your brain, hey, I should make more FSH, which stimulates the follicles, and it's a cycle. So that's one medication that we can use. You can use letrozole. Now letrozole is an aromatase, it's a aromatase inhibitor, and this also is another, I will call it, brain tricking drug, so to speak. And this also blocks the feedback that estrogen only gives to your brain, and once your brain is not sensing that it has estrogen, it releases follicular stimulating hormone, and that helps more follicles to grow, which will produce more eggs. If you need a little extra more help and you go to IVF, then you know we can use gonadotrophins as well, and this is like giving you, instead of like tricking your brain to produce more FSH, which the 2 other drugs I said do, we can actually just give you FSH, and it comes in an injection form, and we give you the FSH, and that helps the follicles to grow. So there are treatments for polycystic ovarian syndrome. There's treatment out there, and treatment really just depends on what your goal is, that we can tailor your treatment. And if all fails, you know, you can always see your obstetrician and gynecologist to start off, and if fertility is your goal, you can also see come to a reproductive clinic like New Hope Fertility Center, and let us work together to try and treat you. So this was a general overview. It was a basic general overview of polycystic ovarian syndrome, and if you want a little more detail in one aspect or the other, just comment and let me know. And I hope that you've learned a lot today, and we will continue this discussion soon. Bye.